Now in studio we have George Shilling. He is a medical insurance consultant. George, good morning.
Good morning to you, Angie.
How are you doing?
I'm good. How are you doing?
I'm good. Karibu sana.
Asante sana.
Now, George is here to break down Social Health Authority.
Yep.
Yes, and I'm happy that you're here because we have to metafuta. To metafuta sana. So any question that you have concerning Social Health Insurance Fund, I need you to come to my WhatsApp 0700917917. Whatever it is that you do not understand, George is here to clarify, and if it is not working in your area code, also do tell us on 0700917917. So George,
yes,
we are transitioning from NHIF. We have
already
transitioned from NHIF to Social Health Insurance Fund.
Yes.
But I want us to I want you to break down the Social Health Authority.
Yes.
That is the new health scheme.
Yeah.
What is it and what is under Social Health Authority?
Okay. Now we have the Social Health Authority as the governing body or the committee that is actually working and ensuring that the Social Health Insurance Fund is able to provide medical cover for all Kenyans. And on the same scheme, we have what we call primary health care. And also we have now the Social Health Insurance Fund.
Yes.
Then we have the Emergency Chronic Illnesses Fund. Yeah. So they are categorized in three stages, whereby we have now the SHA is actually the commission.
Yes.
Okay. And then under SHA now we have now the primary health care. Okay. Whereby the primary health care we have what we call all Kenyans, as long as they are registered in this SHA or SHIF, they are able to get medical services in hospitals, all public hospitals, and as well as all maybe private hospitals that are accredited. Okay, so as long as you are registered, then you are able to get medical, what we call primary medical services. Okay, at the primary level, whereby these primary medical services, you can only get them in those what you call dispensaries or level 3 downwards hospitals. Okay. Yeah. And then,
so what are the primary medical services?
Okay, the primary medical services, other names are known as what we call essential services, whereby we are talking about palliative care. That is, a client goes in there, maybe she has had some pains, those treating pains. Yeah, and we have what we call majorly the minor diseases, like malaria. That's when we talk about primary. And again, we are talking about maternity services, whereby we have the antenatal services, as well as delivery, and as well as postnatal services, whereby the maternal and children health is actually concerned. So all ladies who are registered in SHA or SHIF, whether they pay for their medical cover or not, they are entitled to get what we call the primary health services or what we call maternity services, from antenatal clinic to delivery until postnatal clinics. Yes.
So that is primary.
That is primary.
So it simply means, kwa mfano mimi niko registered, then niumwe na kichwa sahihi, naweza ingia hata kama silipi, naweza ingia tu nikapata services bure.
Definitely. The government will pay. The government is the one which is going to pay what we call now the service provider.
Yes.
The hospitals, we are talking about now the public hospitals, that is level 3 downward, as well as now maybe the private hospitals that are accredited to offer the services for SHA clients.
Okay. So for a Kenyan, like just the same way Gona has asked,
Yes.
I walk into a hospital, there's a headache, there's a stomach upset.
Yes.
Now when you get to the reception there, there's no niseme nambiwa pay for consultation. So first of all, you walk in and they always take you to the is it
The
triage?
portal or no, when you go to the reception,
Yes.
we expect that every hospital should be having the SHA portal,
Yes.
whereby they check in with your national ID to see if you're registered,
Yes.
and see the services that you can get in the hospital. But all Kenyans are entitled for what we call the primary health care services. Yes.
Okay. Naomba tafadhali ufafanue. All Kenyans are entitled
as long as they are registered.
As long as uko registered.
Yes.
Because hapo kuna mahali katikati nimesikia umesema hapo kwa mambo ya mimba hapo. Ujauzito kwamba kama umesajiliwa ama hata kama hujasajiliwa.
No, I've said kama umesajiliwa, when you register, you are entitled.
Right.
That means whether you pay for, you see, we are talking about those who can pay for themselves and those who are employed. We have two categories of Kenyans, whereby we're talking about the salaried ones and the ones who are supposed to pay for themselves.
Okay.
And there are those who may not be able to pay for their medical cover, but now SHA is coming in to ensure that as long as you are registered, you have your dependents intact. Then once they walk into a hospital, they can get what we call the primary health care services.
Hata kama haulipi. As long as uko registered.
As long as you are registered.
Na hata kama haurimiti hiyo kila month.
Yes.
Okay.
That's what it means.
Okay. I will bring you back to the primary healthcare, but okay, let's break it down. So there's the primary healthcare, and then there's the social health insurance fund.
Yes.
So what does that cover?
Okay, that cover is specifically for those who are salaried, whereby the employer normally deduct the 2.75% on a monthly basis and remit these premiums to SHA. And for those who are able to pay their dues monthly, normally the policy says you pay on or before 9th of every month. So if once you're able to pay for your what do you call this one, the insurance, you have now gone a step higher from primary health care to now SHIF, whereby you'll be entitled to more benefits of the insurance cover. More benefits here, we're talking about you can do a procedure. If you have those chronic illnesses still, then as long as you're able to pay or make sure that you remit those premiums on a monthly basis, then you are entitled to more services. Now tumetoka pale kwa primary, tunaenda sasa kwa now SHIF, they call it SHIF, whereby you open up more services outside the primary healthcare.
So this more ni kama pengine mambo ya scanning, pengine mambo upigwe mapicha,
mambo ya scanning. We are talking about scanning. We are talking about kama kuna procedures zinafaa kufanywa. We are talking about dialysis for those who are suffering from hizo conditions. Kama kuna hizo chemotherapy, radiotherapy, yes. Now that's on SHIF onwards.
Okay.
So swali linakuja hapa.
Ndio.
Kuna huyu Mkenya ambaye anajilipia. That is 300. Alafu sasa kuna huyu Mkenya ambaye ameajiriwa anakatwa, ambao pesa yake inaingia either tarehe 9 ama kabla ya tarehe 9. Huyu anapata hizi huduma, na huyu Mkenya mwingine ambaye kwamba yeye hafanyi kazi lakini ana remitio 300. Hizi huduma nazo vipi? Hizi za klasi hapa juu.
Okay, huduma zinakuwa sare. Yani it doesn't matter how much you pay. But huduma they're talking about what we call comprehensive medical cover. This is a comprehensive medical cover. So imetuweka wa Kenya katika level moja. Now there's this narrative, I hope it will change, but you are not supposed to go to a level 4, 5 or 6 with just mafua vitu kama hizo. You're supposed to go there upon referral and on special cases and maybe upon emergencies, then you can go to level 4, 5, 6 hospitals. But hizo magonjwa ndogo mnafamaliza uko chini kwa clinics, dispensaries, na maybe those primary what you call private institutions which are accredited with SHA.
So langu ni huyu Mkenya ambaye halipi mshahara, analipa mwenyewe.
Yes.
Anaweza pata hizi huduma ambazo kwamba umesema ziko classified kwa hii
shift. Yes. Anapata sawa, ndio nimesema imetuweka Wakenya whether sasa unakatwa 10,000, unakatwa 5,000, 2,000 ama yule Mkenya ambaye analipia 300 kila mwezi. The services are the same on shift.
Okay.
Yeah.
So you've spoken about the primary and social health insurance fund.
Yeah.
And now let's go to the emergency. It's emergency and chronic.
Yeah, emergency and chronic.
Yeah.
Yeah.
What does that cover now?
No, that cover is specifically for emergencies where maybe someone can have an RTA or road traffic accident and is rushed to a hospital, maybe needs a head scan, all those things. We're talking about the chronic illnesses. We're talking about cancer. We're talking about what else do we have? Chronic illnesses. Name them. About cancers, sickle cell, anemias, those diseases. Whereby now, once you are paying now, I've said you're clocking to a shift, and then you go upwards to they call it SIF, emergency chronic illnesses fund, whereby now you are entitled to get those services once you go to those hospitals. Normally these services are offered in level 4, 5, 6 hospitals. So that's how it works.
Who pays for the emergency and chronic illness fund?
Okay, the explanation is once you pay now, or when you are a salaried, wakikata ile mshahara yako kila mwezi wakiweka pale, you are unlocking the benefits of SHIF as well as SIF.
Okay.
Yeah.
All right, that is the breakdown of Social Health Authority. It has 3 medical funds, if I'm correct on this. So it has the primary health care, the social health insurance fund, and then the emergency and chronic. We do also know that there has been a lot of discrepancies in the transition.
Yes.
Why are we seeing, why are we not witnessing a smooth transition from NHIF to SHIF?
Well, on my side, I can say I think the government was not very ready, or the Ministry of Health, in that matter, because once they told Kenyans that NHIF was going to end on 30th of September,
yes,
and will be transiting to SHIF on 1st of October. Up to now, I think listeners can be witness that most of the public hospitals, this transition has not begun. It has not begun yet, and I think the information that I have, I think last week they were having those training. They were training their people, their personnel, on those dispensaries and health clinics downwards there, whereby I think there has been a misunderstanding, because the system they are using now is a little bit difficult and not very friendly somehow to some personnel on the ground. So up to now, I can confidently say very few hospitals have begun offering services under SHA. Very few.
So if very few hospitals are offering services under SHA, that means we have few people who have registered, right?
Yeah, that is very true.
Do we have enough people registered to move to SHA?
No.
Not yet.
No, very few. I think in my locality, whereby we have a hospital that is offering those services under SHA, we have tried our level best to make sure that those people who are living around are now registering. But still, there has been a lot of misconceptions about SHA that is ongoing still. So our concerns has been those people who are living within the hospital that is offering services under SHA are able to register. But how about those who are very far from that hospital? So we believe that very few are registering, as long as they are not near a hospital that is offering SHA. Services under SHA.
Is it a case of not knowing?
Yeah, I think the government has not been doing what we call awareness to Kenyans. The awareness has been very poor. I think there has been a problem in making sure that this information reaches that mwananchi yule tunasema ni mama mboga ule wa chini kabisa. You see there are those who may not even understand the language that we are speaking, wanataka waelezewe hata katika lugha ya mama.
Yes.
So somehow that information kuwafikia imekuwa shida. Yeah, so mimi kivyangu nafikiria government ni kama iliharakisha sana hii kitu. Yeah, but it is now with us.
Good morning Swahilipot FM. Nasikiza Breakfast Club. Mimi niko na swali kwa huyo mtu wa SHA. Nikiweka hiyo USSD code, nikirun, nikiweka ID namba yangu inaniambia invalid choice. Nikienda kwa website, bado website iko na issues. If the system has issues, mbona bado mnaiconstitute, mbona bado mnairun? Ama nilienda to my nearest hospital, vile mnasema visit your nearest hospital, wakaanza kuniambia you wait for a few minutes. Nikauliza a time limit to where hiyo system itarun, wananiambia 2 days 3 days ama hata until further notice. Nikaenda kwa hospitali kutafuta matibabu, naambiwa NHIF haifanyi, SHA haifanyi, they only take cash. So if the system is not working, why are you providing that system? Si muanze tu upya ama mtupatie reasons why you removed NHIF and now you're moving to SHA instead of starting something and bado it makes sense to the people bana. Mtuambie ukweli.
George, you had that one, right?
That is too personal.
Yes, that is very personal. Yani amesikia uchungu sana. Yeah.
Okay, ameniita mtu wa SHA. I just provide the expertise. Siko moja kwa moja mimi ni mtu wa SHA.
But anyway,
that is that is in order.
Yeah.
I think Kenyans are frustrated with the system. There has been issues, so many issues. Actually, while I was outside there's someone who called me.
Yeah.
He's trying to pay for his monthly premiums, but the system has been failing for the past 1 week now. So he's been calling me, na leo amenipigia ananiambia hii haifanyi, inaniambia sijui the amount you're trying to pay is not consistent, something like that. So we have been having issues with the system, but let's hope that it is going to work out as soon as possible. But of course, the system has been very friendly to some people. On our side, the place where I'm working, we have been registering people successfully. We have been treating people successfully using the SHA portal. So, but of course, we've been having issues. That is the reality. Sometimes when you check in the client, you are trying to send what we call OTP. It normally delays. Sometimes it fails so many times. You have to make sure that this client, you can keep the client for over 3 hours.
Yeah.
For just a registration process. Sometimes when they come for medication, the only hope now that we are relying is on using OTP.
Yeah.
And using what we call scanning their national identity cards. But we have not received the biometrics or fingerprint scanners up to now. So we only have the logins to check in the clients in the system or the portal. But now we are only using 2 processes to identify them, using the OTP or one-time PIN, and as well as scanning their ID once the OTP is delaying. At least we have that option. But now we have issues. We've been having issues with registering these people. That is the reality.
So, George, if there are issues with registering people, you said that the government rushed the process.
Yes.
So, health is a very
essential.
It's essential.
Yes.
And if you're going to move from NHIF to SHIF, it has to be smooth.
Yeah.
What happens to somebody who's I need to seek medical attention, like I need it now,
yes.
And I'm trying to register over and over and over again. It's not working. There's a system error. And then you go to the hospital, unaambiwa lipa cash. Is this feedback just with when you watu uko kwa ground, ama does it get uko juu pia?
Nafikiri inawafikia. I think we have been like the first week of I think October, when we were transiting, we heard in the news whereby people were complaining they were supposed to be having dialysis, they're supposed to be having chemotherapy sessions with their doctors, but now NHIF was not working and SHA had not begun. Okay, so it reached to them, and the message was sent that kindly attend to these clients. Okay, I think the message has been attend those clients, and let's see when SHA is working, then we can But now pale kwamba inafikia watu wanalipa, well, mimi nafikiria inategemea na hospitali. Inategemea na hospitali ambapo inabidi wakati mwingine utalipishwa. Yeah, but that is very sad. That is very sad. But
from the hospital that you're in,
yeah,
you said it's working.
Yes.
How?
Well, I think our hospital, if I'm allowed to mention it, is Kijana Heri Medical Center, whereby we have been having a team, young and energetic guys who are very fast in learning the system and the processes, especially in insurances as is concerned. Because I'm part of the team, whereby I've been learning a lot on how the systems are running, how we will actually got the logins very fast. I think we began using SHA at hospital, I think on 13th of October. We delayed for the first 2 weeks, then on 13th of October, we've been using it. Right now, we're using it both in outpatient and even in inpatient. Yeah, watu wanakuja kama homa ni mbaya, analazwa na anatibiwa kutumia nini? SHA. And it has been working on our side.
So these are people who are registered?
Yeah, there are so many people who are registered. There are so many people who have been attended using SHA.
So now do we say kwamba kule ambako haifanyi itakuwa pengine ni utepetevu wa the staff ama the hospitals zenyewe, ama where is the issue? Kwa sababu kwa nini hospitali yenu ifanye na kwengine isifanye?
Okay, mimi nafikiria okay, hospitali zetu tuseme kwa mfano za kiserikali, the public hospitals, kila mtu anajua they are always understaffed, because utapata pale labda receptionist ni yule mtu anaandika vile vitabu, anaenda kwa daktari, ni yeye ndo anapeana chanjo, huyo mtu mmoja. So and actually most of these guys who are working in public hospitals, utapata they may not be having the knowledge ya mambo ya IT, ya mambo ya internet. So this thing is very friendly, but very friendly for those who know, at least have some basics to do with computer or technology. But if you don't have, then it will be very hard to get it and understand it. So nafikiri hapo kwa utepetevu pia upo, because I think it's high time the government now should think about recruiting young and very energetic guys, train them, and actually wawapeleke kwa hizo hospitali specifically for receptioning and the claiming claiming part, because it needs a lot of knowledge in terms of technology.
Okay, kuna swali hapa sijui, lakini naamini ni la muhimu.
Yeah.
Kuna wakati NHIF ulikuwa unaweza ukaenda hospitali,
ndio,
lakini ukaambiwa kwamba bana hapa hii italipia vitanda.
Yes.
Hiyo unajua.
Yeah.
Na ikifika pengine ni kutoa hela ya matibabu, kuna kiwango fulani kwamba kama ni 20,000 ni 20,000 na hawapiti hapo.
True.
Hiyo ni kweli.
Yeah.
So huku kwa sababu kwenu inafanya kazi.
Yeah.
Hiyo story hiyo iko bado kwamba wao wanasema ni kitanda na kama ni matibabu ni kiasi fulani.
Okay, vile SHA imekuja kama what we call a comprehensive medical cover. Like the service provider is not supposed to ask any money from Kenyans. Okay? Whereby, for example, when we're talking about the primary health care, the essential services, this mgonjwa akikuja anafaa kupewa zote. That a normal dispensary, those services ambazo zinapatikana kwa normal dispensaries should be offered accordingly.
Okay. So let's break this down.
Yes.
Normal services, I walk into a hospital.
No.
Nimeenda pale nimesema nasikia nina headache.
Ndio.
Ama naumwa na tumbo, ama
Yes.
fever na nini.
Yes.
So when I get in there, I'll be at the reception first of all.
Yeah.
And then baadaye watanipeleka pale, triage. Yes, triage.
Yeah.
For them to check my weight.
Yes.
And then my pressure, right?
Yeah.
And then after that, I'm taken to see a doctor.
To see the doctor.
Yes, and then the doctor anafanya diagnosis.
Yeah.
And then pia naambiwa dawa ama naenda lab. Natumwa lab.
Yes.
Iyo process yote.
Yes.
Is it free once I'm registered?
Yes, it's supposed to be free.
It's supposed
Totally
to be free.
That is from the policy that is written in SHA. Policy inasema huyu mgonjwa akija, consultation should be free, medication free. Kama kuna tests anafaa fanyiwa zikuwe free. What I do not understand now, maybe this can be answered another time,
Yeah.
is actually, once a hospital is accredited, there is that yale makubaliano kwamba unaweza kuona mgonjwa up to this limit.
Yes.
Kama kwa mfano wakati ule wa NHIF mgonjwa alikuwa anaambiwa outpatient limit yake ilikuwa ni shilingi 500 per visit. Okay, but now with SHA ni kama it's just mpatie kila kitu comprehensively. Kama kuna testing afanye even in outpatient, kama ni scans, kama ni nini, outpatient level anafaa kufanyiwa.
Mpaka dawa ni bure.
Mpaka dawa ni bure, everything.
So this is something that the government has committed to pay for.
Definitely, because in other cases, for example, wakati wa NHIF mtu alikuwa anaenda kwa procedure, kwa mfano operation, utasikia NHIF akwambia kama kwa mfano bili ni 300,000, utambia NHIF itasimamia 230,000, zile 70 mtajaza.
Yes.
That narrative is not supposed to be there anymore.
Hakuna hiyo na
hakuna.
Is not supposed to be there, ma
hakuna.
Now,
yes.
Since you have said it's working in the at the hospital that you work in,
yeah.
Wenye wamekuja kutibiwa,
ndio
wametibiwa bure
kabisa. That is the reality. Watu wamekuja kutibiwa bure using SHA.
Wamepata dawa,
wamekuwa attended very well.
Yes.
Yeah.
George wewe.
Sasa wacha niulize hili.
Yes.
Kwa sababu naona 2 days ago pale hospitals walikuwa wamesubmit over 1.6 billion claims. You mean hospitali zenye zinapeana sahi ama SHA ina work ni kidogo na tayari ni 1.6 billion.
Yeah.
Inaweza kuwa kuna mchezo hapa katikati ama it's worth it, kwa sababu umesema pengine hakuna hata limitations zozote za kwamba pengine mtibu mpaka kiasi hiki.
Yeah, I think that can be very true. We are talking about those umesema SHIF and the emergency chronic illnesses. They are very expensive.
Okay.
That is the reality.
Yes.
There are some hospitals who can charge a patient up to 1 million for a procedure.
Yeah.
Sawa. So we expect that one to happen. Yeah, so sioni kwamba hizo figures zinaweza kuwa ni za uongo. That can be the reality. Given that we have so many Kenyans who are suffering of disease, so I expect kwamba hiyo inaweza kuwa ni ukweli kabisa, because now medication ama matibabu imekuwa expensive. That is,
alafu sasa serikali na kulipa kwao, kwa sababu nakumbuka last time tukisikia kwamba NHIF ndio imeisha, lakini pia mahospitali walikuwa wanadai a lot of billions again kwamba hazijakuwa covered. Sijui sahihi inakuwaje katika hiyo claiming, wanalipa haraka?
Okay, I think from mostly the contract, serikali wanalipa after every 3 months. So labda saa hizi we are giving them the benefit of doubt. Tunatibu wagonjwa tukisema ni kama una risk ya kidogo. We expect kwamba watalipa. That is our expectations, kwamba watalipa, because kama wametu accredit, then that means they should honor the agreement that we have. Even though kuna madeni yalibaki nyuma hata wakati wa edu afya ukiwa na wanafunzi, kuna madeni yalizama. Kuna madeni yalizama na NHIF. But this is our government. I think serikali na madeni ni kitu ambacho huwezi kukitenganisha.
So George, when you say okay, so NHIF and then now SHIF.
Sure.
Now, as we are moving to Social Health Insurance Fund, are these the same employees who have been under NHIF, or it's a different team?
I don't think it is a different team, because the buildings that were being used by NHIF, the same buildings that are now being used by SHA, and even the staff. Mostly you'll find that it is the same staff that has been working. Unless kule juu kama walibadilisha, but even in these offices za huku ground, utapata watu ni wale bado wanafanya katika hizo ofisi.
Okay.
Yeah.
And that is going to take me to, we've had a lot of discrepancies with the NHIF.
True.
And in terms of money, yenye imeenda missing, hii pesa yote, now that we are going to Social Health Insurance Fund, are we forgetting about it because now it's a new body?
No. I think the government is supposed to honor yale madeni ambayo inadaiwa. And nafikiri hata last time president akiwa hapa Kwale, alitangaza kwamba analipa. So we expect kwamba hospitali zitaendelea kulipwa. It doesn't matter how long it will take, but we expect yale madeni yote ya NHIF yatakuwa cleared, And of course, while we were transiting to SHA, they said SHA will honor zile madeni za NHIF.
Okay.
Yeah.
And then still on the same, I've been a contributor of NHIF, right? What happens to the funds that I've been contributing to NHIF? Do I forget about that and then start afresh with Social Health Insurance Fund?
Yes, you have to forget about hizo, because wakati wa NHIF, this is how insurance companies work. Kifika mwisho wa mwaka inarushwa, tunaanza mwaka mwingine. That is how it happens. So usiseme nimecontribute kwa miaka 10 niko na pesa mingi huko. No.
Yes.
At the end of every year or financial year, hiyo inaisha, unaanza nyingine mpya. Yeah, that is how insurances work.
Okay. Now, taking me to now the Social Health Insurance Fund, which if you are working, it's being deducted. It's among the statutory deductions.
Yes.
Most of us received a message. Yeah, you received a message that
you have been migrated.
You have been migrated.
Yeah.
Once I receive that message that I have been migrated, am I already registered or do I need to go and confirm?
Okay. Now I think our listeners should get this very clear.
Yes.
Kwamba that message just meant to some very little percentage that you were registered.
Yes.
So now you have to update your profile and update your dependents.
Okay.
Yeah, because you can go to the hospital, the ID is taken into the hospital logins or the portal, whereby they can check and see you as the contributor. But when you go to the dependents, they will not find anyone. So that means everything now begins afresh. You have to register, or you have to update your profile and update your dependents. Yes.
Okay. So I have to register, update my profile, update my dependents.
Yes.
If I do not, it does not pick information on my dependents.
It won't. It has not. Yeah, we've been experiencing that. Once you get the ID of the contributor, most of the times it will say this is okay, is valid.
Yes.
On our portal as the hospital. But once you go to there's a place where they say dependents, you find none. So the advice is every Kenyan should register fresh and add their dependents afresh. Kabisa. Salim Barisa, you'll be shocked. Usienda na mtoto hospitali akiwa mgonjwa alafu hautampata kwa system. That is the reality.
Utabidi ulipe because
no, but now the system, huyu mtoto kwa mfano in our case kama ana fevers, we normally take it as an emergency, anaenda kutibiwa. Then we advise you on what documents that are needed. Tunaweza tukafanya ukaleta hiyo birth certificate kama ni mtoto that is above 6 months to 18 years, tuna upload kwa system. The registration is very friendly. Normally once you're done with the registration, hapo huyo mtoto anaweza kuonekana na akakuwa checked in kwa system na akatibiwa. Yeah.
George, is this a better medical scheme than NHIF?
Yes, this is actually the best.
Why?
Especially, I'm not actually sipigi debe serikali hapa, but tumezungumzia hapa upande wa kina mama about the maternal and child health. We used to have Linda Mama. Okay. Linda Mama was offering only a very small amount of money or a small amount of package, whereby hawa kina mama kama wangeenda kwa procedures kwa hospitali, kwa mfano kama imebidi azae na CS, mostly wangeitishwa pesa, wangeitishwa pesa hiyo CS ifanye. Yeah. So but now using SHA, the reality ni kwamba kuna package nzuri ambayo sasa hata huyu mama hata kama ni referral ya ambulance anafaa abebwe na hiyo, na SHA will pay. Yeah, fanywa referral, akienda kama ni CS afanywa CS, amaliziwe, and that's it. The hospital will charge from the card.
So it is a better scheme if it's well better implemented.
Yes. No. Thank you for that. If it is going to be implemented as the document says, then this will be the best medical cover or scheme for Kenyans.
All right. Thank you so much, George. That is George Shilling. He is a medical insurance consultant. You have enlightened us on a lot of things that we needed to understand.
Okay.
So thank you.